Nursing's not an easy job. It's never easy, but the rewards are so great that the thanks you get from your patients, and at the moment there's quite a bit of bad press about what it is to be a nurse, and everyone's worrying about, well, how does that affect me? But there's some brilliant stuff going on in there as well.
How's your placement going?
Yeah, it's going really well.
Okay.
Really enjoying it.
My role is to support student nurses when they're on placement and to support the mentors of those students while they're on placement. So making sure that the learning experience that they have is wide, it's varied, it's appropriate, and that the students get the right amount of support while they're in clinical practice.
What do you know about atrial fibrillation?
It's going very fast.
Okay, not always.
Yeah.
Sometimes it does, sometimes it doesn't.
In the first year, you usually get put with HCAs to learn the basic care for your patients, go through the washes, and just you almost become their shadow, just while you get used to the ward. And then your mentor will support you in learning how to do observations, going on jog rounds and learning different drugs.
I remember Lomax starting his training as a very, very brand new student, and I've had the pleasure of watching him grow from being quite anxious and a first year student to being a very knowledgeable, experienced, skillful nurse, and he has now reached his management placement where he is working in A&E, which is his chosen pathway.
Your temperatures are normal. Have you ever fainted before?
No. Training for student nurses, it's 50% theory, so they pick up that from university, but it's also 50% practice. They have to have all of those knowledge and skills on the ward directly with patient care in order to be a nurse, because you can learn the theory, you can open up a book, you can read about what it is to be a nurse, but until you're actually on the shop floor caring for those patients directly, you really have to be there to appreciate what it's like.
And do you think your skills have improved since you came from your first place?
Yeah, absolutely, definitely. I'm a lot more confident in what I'm doing.
We expect students to be hardworking. We want them to enjoy their placement most of all. We want them to get stuck in. We want them to be involved in patient care. You're not here to stand and watch others do things. You're here to get on with the job and look after patients, and we will do everything we can to teach you how to do things correctly. I see adult branch nursing as the foundations of a good nurse training where you can diversify afterwards.